My name is Marianne Brodmann. I'm the head of the Division of Angiology here in Graz, Austria, at the Medical University. It is really for the first time, or not for the first time, it's showing another technology, which is after what we have seen in Ramon Vacco's trial, that bioresorbable scaffolds are really something which can be used in a good way, and which are really successful in achieving a better outcome for patients below the knee. And I think this is very, very important, that we have another bioresorbable scaffold trial in the below the knee space, which is showing this important positive outcome. And that's so important for me, and that's so relevant. The magnetic scaffold has some kind of advantage over other scaffolds. And the thing is that you can produce different lengths. And this is not something which is taking a very long time. So you can also have longer scaffolds, and we have right now really long scaffolds in the new trial, in the randomized controlled study. We are going to start in a few days. That's so important that the technology which is behind the magnetic scaffold is allowing to adjust to the lengths, and this in a very quick time. And this is so important for us. So that's one thing. The second thing is the strut thickness, which is also great, and the radial outward force, and also the time of resolution, which is also great. It was a critical limb ischemic patient population, as first in human, where we treated mainly patients with lesions in the upper part of the below the knee space. And it was as a typical first in human trial. It was not randomized control. It was just the first in human trial where we applied this kind of technology. We did the pre-dilatation, then we did the placement of the scaffolds in some patients. We did the post-dilatation. Yeah, and the main arterial segments we were included in this first in human trials were in the upper part of the below the knee arteries. The key findings are that the outcomes are great, that we do not have a high rate of restenosis. This is really something which is very, very, very promising for us, and that also the clinical outcome are great. So that not only the scaffold itself is working, but also that this is achieving a better clinical outcome for our patients. The next steps is a randomized controlled study, and this study is right now already on the way. We have FDA approval that we can start this randomized controlled study in the US and out of US, and yeah, we are eager to start with the first patients in the next few weeks.